And we're off.
Welcome members of the audience and welcome panelists who will be introducing themselves very shortly. I'd like to say thank you to the FCI for inviting me to chair this important panel discussion today. And I'd like to thank Digital Health for hosting us. So my name is Yinka McKinday. I'm the Director of Digital Workforce and Professionalisation at NHSX. And I've worked in the field of digital health and tech for the last 17 years, prior to which I had a 12-year career as a frontline pharmacist, working across multiple care settings. And I'm also delighted to be a trustee of the FCI. So today we've brought together a very impressive panel of leading clinical informaticians who will offer their reflections on a recently launched job description for the role of the Chief Clinical Information Officer. And they'll also offer their views on what more they feel is needed to solidify this role. Now, a distinguished panel is made up of leading clinicians spanning medicine, nursing, and academia in England, Scotland, working in roles locally and also national roles. I think it's important for me to acknowledge that the panel is a small but nonetheless very important representation of those passionate and dedicated colleagues working across the system in CCIO roles or roles leading to CCIO roles. And they will speak to the work that's been very much a collaborative effort of a diverse set of individuals, particularly in terms of clinical professional backgrounds. So I'd now like to invite each of the panelists to introduce themselves, please state your role and where you work very briefly. And I'd like to start with Caroline, please.
Hi, good afternoon to everyone, and thank you, Yinka, for the introduction. My name is Caroline, and I'm a critical care nurse in Scotland. I just moved here about 3 months ago, and I'm now a freelance digital nurse consultant. I was a former nurse informatics lead in Oxford and worked closely with CNIO and CCIO and other digital leadership role. I'm a nurse passionate in optimizing the use of technology to improve patient outcomes. Hence, I joined the NHS Digital Academy cohort 1, and from then on I can't stop. So being involved in this CCIO job description working group gave me actually an opportunity to share my 20 years of nursing experience, whereas 10 years or a decade of that was dedicated to using electronic health record, being a digital leader and bridging the gap between the operational, clinical frontline and digital team, which I find really exciting. So look forward to seeing you all.
Thanks, Caroline. Then I'd like to move to Stephen Baguli, please.
Steve Bagley. I'm a consultant at Sex Health and HIV. I'm clinical director for eHealth for NHS Grampian and clinical co-chair of the Health Board Digital Leads for Scotland. It's been great to have been invited to take part in the preparing the model job description invited by Leslie Holdsworth. So great to be here and to take it on its next part of its journey.
Thank you. Afsal Chowdhury, please.
Excuse me. Yes, afternoon, everyone. Afsal Chowdhury, I'm a renal physician by training. I'm still doing sort of 12 weeks of inpatient care per year, which is mainly general nephrology, transplant and medicine. I'm also the director of digital and the CCIO at Cambridge University Hospitals, and I also have as a role as the vice chair of the Professional Record Standards Body.
Thank you, Afsal. Next, Vijay Joshi. You're on mute, Vijay. Thank you.
Hi there, everyone. I'm Vijay Joshi. I'm an A&E doctor by background, been working in clinical informatics for about 20 years, held a wide variety of roles in the NHS and in the private sector. Currently, I'm the digital advisory lead for health and life sciences at Avanade, but I'm also a clinical tutor at Brunel University teaching technology for healthcare. Previous roles include CCIO, but I've also held other CXO level roles such as Chief Data Officer in a number of national organizations. My interest in this is that it's been very much self-driven over the last 20 years, and the last 10 having been involved in the CCIO network, really starting to see the professionalization of this industry. Recognizing that we're still in early days, keen to support and try and formalize the Chief Clinical Informatics Officer role.
Thanks, Vijay. Gareth Thomas.
Thanks, Yinka. Afternoon, everybody. I'm Gareth Thomas. I'm the Deputy CCIO at NHSX. By background, I'm an intensive care consultant in Salford in Greater Manchester. I've been involved with clinical leadership roles for about 12, 13 years now, latterly with clinical informatics. The thing that really drove me to get into this was the ability to improve care for citizens and experience via digital. So very much a quality and a change focus. Alongside my current role in NHSX, I'm also the Vice Chair of the Professionalism Steering Committee at the FCI. And it's an absolute pleasure to be here today and talk about this essential topic as to how do we encourage colleagues to come into the clinical informatics workforce and put some structure around that. So really look forward to the discussion.
Thank you. And I'd also like to just mention that we have another colleague who's in the audience and will join us for the Q&A session, and that is Jo Dixon, who is the Chief Nurse at NHS Digital. So before we, we have just under an hour now, and we want to engage the panel in a discussion, and then we want to open the floor to questions. But before we launch into the questions, I just thought it would be useful for me to set some brief context as to how we've got here. So as the field of digital health has evolved and grown in prominence over the last 50 years or so, so have the diversity of new roles that have been created, at times very organically, in order to respond to the emerging requirements in terms of knowledge, skills, in order to help deliver transformation within organizations. Now, the CIO role was, which is one of the more established and accepted digital leadership roles, was created in around the 1980s. But more recently, the Chief Clinical Information Officer role has emerged to complement the CIO role, but has been to date in a much less formal capacity. And whilst the rationale for the role has never been in doubt, I think it's fair to say the definition of it has always been a topic of debate. And the position has been less formalised and has tended to be held by a senior doctor, I think it's fair to say. So between March and September, well, actually, no, I should say before March and September, a very important piece of work last year was kicked off by the FCI, which was to develop the competency framework. And out of that work, and that competency framework was published in January, and a key recommendation of that work was that a job description for the role of Chief Clinical Information Officer was created. So between March and September this year, a working group was convened to develop a job description for the role of CCIO, and it had diverse membership covering medicine, nursing, pharmacy, and AHPs. And this was launched in September, which has kicked off a formal consultation phase, which concludes in November. So with that in mind, my first question to the panel is really just to understand, I'd like to ask each of you this question, what your understanding is of the CCIO role from your own personal experience. And I think I'd like to start with Afzal, having worked in this capacity as a CCIO in a local provider organisation, please.
So, so I think for me, I mean, I've been doing this role now for about, well, just about 10 years. And it's evolved and grown as the sorts of tasks that I've been asked to undertake have grown, and that reflects the sort of evolving digital maturity within the institution where I work. I think the pivotal thing for me has been around that very obvious notional bridging between the clinician and the, for want of a better phrase, the IT world. But that comes in many facets. And so much of what I've tried to focus on is really about understanding from clinicians what the nature of their challenges are and their problems are, and then helping to turn that into solutions. Often there's a tendency, particularly as time has gone by and everybody's become used to seeing apps and products out there, for clinicians to immediately jump to the notion of, I'd like this app, or I'd like that solution, or I'd like this product. And actually, really what we need to be getting down to is the nitty-gritty of, if you like, what are the professional needs? How are we going to understand those needs? How are we going to articulate the professional behaviours and attitudes and the, what I would like to call the sort of the who, what, when and why aspect of being part of the wider healthcare system? And then what does that mean in terms of turning that into digital solutions, technology enabled solutions to support those clinical pathways? So, and I think without that understanding and without helping people to be able to articulate some of those, I think some of the issues that we've had historically in the past have arisen simply because somebody's chosen a product and then find that actually it doesn't really do what they need it to do. And that's not because the product has been faulty or substandard in any way, but simply that it just hasn't really addressed the need that was originally there in the first place.
Thanks, Afzal. Actually, Gareth, I'd like to come to you next, obviously, because you operate in this capacity on a national level. And I'd be interested to get your thoughts on whether what Afzal has said is sort of aligned with how nationally we see this role sort of developing and the function of that role, please.
Absolutely, and I was listening intently to what Afzal was thinking, and reflecting around my experiences, which are very similar. I mean, I've described in previous forums that the CCIO role as being the best job in clinical leadership, and the reason I say that is it gives anyone who's interested in changing and improving services a tremendous toolbox with which they can work to make things better, make things more efficient, and essentially serve patients and citizens more in the way they would expect to be served in the 21st century. So it's a huge role, and there are many opportunities within that. I think as Afzal was describing, a lot of what the CCIO does is a translational role, if you like, across boundaries, and really understanding the impact of change from different stakeholders and what their perspectives are, and trying to find some alignment across that group. I think change in general is never easy. I think digital change particularly is never easy, and part of the CCIO's role is to bridge across those different groups and understand how we can improve the service for patients and citizens using technology. In terms of the national agenda, I think it's absolutely essential that we're able to put the necessary impetus and the resources behind these roles. These roles need to be truly multi-professional. As you said, Yinka, in your intro, in the past, these have been, there's been a tendency for these to be occupied by senior doctors. And what we need to be really clear about is that the CCIO is a truly multi-professional role to which anybody with appropriate competencies can apply. And for me, that is one of the significant things we need to push now, is how do we make this attractive to as many stakeholders as possible, as many clinicians as possible, and how do we ensure that we can get a real diversity of applicants and interest in these roles, such that the role itself can better represent the services and the citizens that we serve.
Thanks, Gareth. And I think that's a nice segue to Caroline, who represents the non-medical professions, but I understand is also an aspiring CCIO. So I wanted to get your perspective on, are you feeling encouraged by what Gareth and Afzal have said, and obviously the job description, or do you still feel that there's some concern about your path to becoming a CCIO?
So in terms of using this job description, for me, this is essential as a guide and as a pathway for me to reach what I wanted to reach in terms of my professional career. So this job description is not only, as Gareth had mentioned, not only for senior doctors. You can be a clinician in different background and be able to become a CCIO. So I think it's beneficial for individuals like me who would like to focus on what competencies would I like to achieve and I should achieve as a CCIO, and how can I develop myself professionally and personally to get to this point, and how am I going to progress my career in the field of clinical informatics. I think the experience that I had as a digital leader, I wasn't a CNIO, but as a digital leader, a clinical informatics lead, I was able to provide visibility of the needs of the clinical services and promote, communication between the services and the digital program that's coming into us with the vendors, etc. So this gave me an opportunity to provide expert knowledge and understand how our digital solution can actually meet these clinical needs and how it may evolve and develop. And as Afzal mentioned, bridge gaps in function, support our goal to be paper-free at the point of care. So I think this job description is exceptionally going to be something phenomenal for people like me aspiring to be one of the digital leader here in Scotland, to be particular.
Brilliant. Just some comments, I think, from VJ, because I know you're coming at this from a slightly different perspective. I know you're a clinician, but you're also in academia. Is there anything emerging in the land of academia that could help us navigate this, or is there something that we're still missing that we need to be aware of that's coming up in the future?
So from my perspective, very much as Afzal and others have said, that historically we've recognized that there's a disconnect between an IT implementation and the clinicians who actually end up using it. As in, we can specify a car must have 4 wheels and a steering wheel, and all the boxes will be ticked. But whether the steering wheel is inside the car is another matter. So it's been recognized for a long time that we need to have clinicians involved in the specification and commissioning of the clinical information systems within a hospital. But the issue we've had to date is ensuring that those roles are actually adequately empowered in order to fulfill that mandate. So what we've seen sort of historically is that whilst it's been recognized, as individuals have only been given maybe 1 day or half a day even as a tack on to something else in order to fulfill this function. And what this job description really does is ensure that clinical informatics as a function within a healthcare organization is is empowered to deliver what it needs to do. And we're not talking just about the CCIO as an individual, but the office of the CCIO in terms of, per the Wachter recommendation, that there will be one lead individual who will then run a team of 4 or 5 in a normal sized trust of clinical informaticians, maybe deputy CCIOs, someone less, but operate at board level. So it's very much from a sort of transformation, and maybe if we're talking about academia, from an organizational change management perspective, it's looking at how do we build this structure in, get clinical informatics a space at the executive table at board representation, and ensure that it is accountable, empowered, and given the resourcing it needs in order to deliver the function. So this goes to both the structure, but also the experiential and knowledge requirements for an individual to hold this role. So this JD is very, very useful in terms of setting both how the role needs to be structured and supporting roles, but also guide current and future CCIOs on their learning journey to ensure they can be effective CCIOs?
Thank you, Vijay. So I strategically left Steve to the end because I'm going to be asking Steve to do a short presentation to give us more background as to how the job description was created and developed, but also to give you the opportunity, Steve, to give any reflections from a Scottish perspective. I don't know whether there's anything that we can learn from one of the other nations in terms of how they're approaching this and maybe how this has been taken up so far.
Well, I think the main thing about Scotland is it's a lot behind England in terms of the CCIO roles. I mean, we have no national CCIO. Health boards typically don't have CCIO or someone working at the level, even under a different name. I mean, there are the odd pockets of exception here and there, but generally that's the case, which has been a problem that many people have recognized for a while. So the timing of this job description is fantastic because it means that we can now work towards a target model of what we should have in place nationally, what each health board should have, without perhaps the dilution of the meaning of the acronym CCIO and what it actually is as a role, which because it's been knocking around in England for such a long time now, there's 57 varieties of what a CCIO kind of is. So we have, in a way, although we're late to the party in Scotland, we now at least have a slightly purer concept of what a CCIO is, and therefore we can use that to build a target model to adopt nationally and across the country in the health boards.
Yeah, thanks. So can you share with us how the JD was actually developed?
Certainly.
If you'd like to present. I think you've got some slides that you.
Yeah, I think Lynn, yeah, brilliant.
Thank you.
Okay, yes. So it probably all kicked off. I mean, you've mentioned Yinka the history last year with the competency structure which was put forward, and the ambition to have a model CCO job description. But it probably got a bit of an extra impetus back in February when I think it was Mike Krieger kicked off a thread in the digital health network on CCIO job description shaming, which had quite a lot of interest and various people chipping into that with lots of thoughts. And I think that led to probably some behind the scenes discussions. And then I got contacted by Leslie Holdsworth, AHP, to working with the FCI, to be a member of a group to start putting together a model job description. So Leslie and a few others, obviously Lindsay majorly involved as well, pulled together this group of roughly sort of 7 or 8 people, I think, possibly in total, who were supported by Lindsay to develop what a model job description might be. So a assessment framework was put together. It's described on this slide as a blunt tool. I think it was actually pretty good. It was the looking at the core competencies and then a sort of grading system. We put a shout out for people to provide CCIO job descriptions that they had used, either their own role or ones that's been advertised, and 41 emerged from across the UK. And in groups, rather individually, we went through a number of these job descriptions, scoring them using this framework, and came together at the end to sort of cross-check and see where our thinking aligned. There was some variation, I think it's fair to say, in how we perceived the quality of different job descriptions, but on the whole, it was fairly easy to spot ones which were really pretty good and others which were less so. So through this process, we identified a handful which could be sort of described as best in class, and those were distilled down to form an exemplar, which then was worked on over a period of another few months to get it into a sort of a level of detail which was adequate to take on to the back to the FCI for their feedback. And it's at a point now where it's had a bit of a chewing over from various groups. It's had some really valuable input, different perspectives, and it's now open to much more public consultation and I'll hand over, I think, to Vijay to talk about the kind of key messages that are in there. Hopefully you've all read it.
So the key messages is that it is a senior role. This is an executive role, and is a full-time role and funded accordingly. The individual holding the post is a CCIO first and foremost, and whilst they may continue to have a patient-facing role, that is a minor part of the time. But there is experiential and knowledge requirements to hold this role. This is all competency-based, and we're hoping that this FCI guidance can help individuals who are already enrolled to identify and address any gaps that they may have. The main thing, though, is that this is, again, not a one-person role, but it's an entry point into the Wachter recommendation of having a team of skilled clinical informaticians covering all the domain areas. Whilst there may be several deputy CCIOs or other such roles in the organization, there'll only ever be one CCIO, and that individual will be an executive working at board level. So the main thing is that this needs to be attractive and irrespective of any professional background, and all professional backgrounds should be welcome.
Thank you both. Does that conclude your slides? Yeah.
It does.
Thank you. Okay, so I think it's particularly exciting that we've gotten to this point, because it's been talked about for quite some time. We've already got some questions from the audience, some really good questions, which I'm going to come to in a second, but I just want to kick off the reflections, please. And anyone can start. How could this job description this guidance have benefited your own career journeys? Who would like to kick that off?
I'm quite happy.
Yeah, Steve, yeah.
And just to avoid, I mean, if this had been in place, it would have made it a lot clearer what I'd have had to have done to get to get the jobs I currently do, which in some places might be described as CCIO roles, but they're not really in the true sense of this new model. So basically, it would have made it a much more rigorous exercise to achieve that. Of course, the other flip side of this is that it is quite a rigorous exercise based on the competency framework, and therefore people need to have the competencies to take on the role. Therefore, there needs to be the training and courses available, of which, although I did an MSc in healthcare informatics just for 10 years ago, that it is a bit of a bottleneck at a time, which is only just starting to be released in terms of the ability to do the training to get these get to the level to be able to take on these roles. So it would have been great to have, and it still is brilliant to have.
Great. I think Gareth was next.
Thanks, Yinka. So, I mean, the first thing to say, I had tremendous support within my organisation from the executive team and particularly from Rachel Dunscombe as CIO. But even in that context, we didn't have a model job description. And I think I did a similar exercise to the one that we've done here, which is basically downloading job descriptions from across the world and pulling it together in terms of saying, well, is this actually what the role, the requirements are of the role? So whilst for me personally, I was able to do that, where this is also important is it speaks to the wider team and it builds meaning within organizations of, look, this is what the job is and this is what we're trying to do, which means that it would be much simpler with this type of job description to communicate to others in the MDT of this is what a CCIO is and this is the ask of you and your team to step forward and become part of that office function. I think the other piece we need to be really clear about with this is, yes, there are 111 competencies, but we're not necessarily expecting any one individual to take forward all those competencies. And what we should be saying to people is there are a range. Where does this fit with you? And how can you contribute to this function within an organization? So hugely supportive. And, we need to build on this and use this as a model across all our organizations as part of that template for an office of the CCIO.
So Gareth, just to clarify, are we saying that even though we've got all of those competencies for the CCIO role, some of those competencies can be almost delegated to other team members to deliver?
Absolutely. And again, if I go back to my...
Oh, I can't hear you, Gareth.
Oh,
okay.
Can you hear me now?
Yeah.
Got me now? Yeah, no, absolutely. And if I go back to my CCIO team as was in Salford, I think almost by default we were very different, which meant that there was a lot of strength there because we all brought something slightly different to the team. And I think we need to be absolutely clear that I wouldn't expect any one individual to hold all of these competencies. It's about how you build that diverse multi-professional team so that you've got them in totality, and that will be the same with any other sort of executive team. You want a group model in terms of how the office is structured. Thank you.
Can I come to Afzal next?
Yes, so I just really wanted to build a little on what Gareth had said. So I was very fortunate in the sense that, more by luck than judgment, the team that I had around me, I was supported by extremely skilled people from all walks of both clinical and indeed operational areas across a wide range of disciplines. But as I say, that was more by luck than judgment at the time. And I think actually this job description empowers those to be making the right case to their executive about what that office needs to look like and the skill set and the capabilities that it needs to represent. I regularly get asked by all sorts of hospitals, both within the UK and wider, to give advice on these sorts of things and to talk about my experience. And quite often it is still a one-person show trying to get something very limited off the ground. And the reality is, in the absence of a properly resourced team, the ability to make significant progress is hindered substantially and probably will never ever happen. And if institutions are serious about using technology to improve the quality of care that they want to, then they need to make sure that they put the resources in. And I think this really helps to give them some ammunition to make that case.
There is a question in the audience actually about number of PAs to fulfill the role. I don't know whether, I'm sure this has been thought about, but in terms, just speaking to your point about sufficient resource has to be put in, and the post holder has to have, sufficient capacity to be able to do this. Has there been any thought around number of PAs? How many PAs does this constitute? Or yes, Afzal.
So two very quick observations. One is PAs obviously is mainly consultants. So in the interest of not talking about doctors, if we talk about sessions, so I can tell you what I have 8 sessions that are badged as this. The honest truth is it consumes far more than that, but that's out of choice and because I enjoy what I do, although I suspect my wife sometimes is less happy about that. But it seems to me that I think if you do this less than half time, that's not going to be good enough. But equally, I would argue I massively benefit from being able to retain some of my clinical activity. It keeps you grounded in what you do. Your colleagues see that you are not only helping to implement and shape the future of the technology, but you're also using it and living it and breathing it with them too. So for me, 8 seems like a good fit. 8 sessions a week.
Thank you. Gareth?
Yeah, just to back up what Afzal said. So I think I started on 4 initially as a CCIO, which is 2 days a week. Yes, it needs to be some sort of currency that applies to all the professions, doesn't it? So whether we talk in hours or days or PAs, we need to have in our minds what's required. Regardless of the number, I think it needs to be absolutely clear that this is taken as a serious part of the overall clinical leadership team within an organization. That's how I would picture this, in terms of this is the same as a postgrad educational lead, a governance lead, or a medical nursing AHP director type role. That said, I think we need to be careful that we're not overly prescriptive within this, because what we don't want to do is make this perceived as unachievable for any given organisation. So I think there needs to be a degree of flexibility while still saying this is on par with any other senior clinical leadership role within an organisation.
Thanks, Gareth. So I'd like to move this discussion on to bring in our nursing colleagues, Caroline and potentially Jo Dixon. So then we've got a question which is, what are the panel's thoughts on professional diversity and the existence of the CNIO role? And actually, more generally speaking, as an ex-pharmacist myself, how do we ensure that we do have that we do achieve that clinical diversity in this role, in general? So, Caroline, would you like to share your thoughts on this? And then I think I might bring in Jo as well.
Sure. In terms of bringing diversity into the role, I think, as I mentioned earlier, we should be focusing on the competencies as individual rather than based on the clinical background. And it's about us working as a multidisciplinary team and leading as a multidisciplinary leading a multidisciplinary team that works with the CCIO, or should we say Office of the CCIO. So this FCI core competency framework, we should use this to scope of the CCIO, but also inform the personal development plans, and also to support the personal development of competencies of clinical informaticians within team, not only the CCIO, also the team around the CCIO, and for example, me as a nurse informatics lead in Oxford, we have a CCIO, we have a CNIO, but I was given the opportunity to join the NHS Digital Academy and learn more about clinical informatics and digitizing healthcare. So that was really useful and a great use of resource from my previous organization on helping me build my career as a digital nurse leader. On this note, I'd like to ask what Jo thinks about the difference of a CNIO and CCIO from her professional perspective, from her experience, as I have not experienced being a CNIO myself.
Thanks, Caroline. I'm in a really fortunate position in that I've been a CNIO and a CCIO as well. I think I agree completely with what Caroline's just said around the use of the competencies and the development of people. But one of the key things I think around this is that we need to attract people into this role who don't have medical backgrounds, and we need to think about how we do that. So I think there's work to be done on this. The key part of this is that everybody's talked about throughout this discussion is it being at the right level within the organisation, and that's at executive level. So actually, how do we attract more non-doctors who want to work at that executive level, but as clinical informaticians rather than as chief nurses, for example? So I do think there's some work for us to do that with the non-medical professions, but that's absolutely something we should be doing. Just to support what everybody else has said today, it's really important that we have that multi-professional role, as the CCIO can have any professional background. But then, of course, you would then still have the CNIO. So it's really important within, sort of bigger organisations that you have that office of the CCIO, as some people call it. So there is definitely a role for a CNIO, even if you had a nurse CCIO, because that's how we bring all of these things together. I do think there's also something about us looking across outside of the acute sector for some of this, because actually outside of the acute sector, there are more nurse executive leaders who might be able to kind of step into these types of posts, and where there are already examples of people working at that level. So I do think there's something here where we need to look across the sectors, because we do tend to focus with CCIO job descriptions onto the acute sector, and I think there's things we could learn from outside of the acute sector that might help support with this.
Can I pose a challenge? So my perception, and it may or may not be correct, is that senior clinical leaders within healthcare organisations we often see, obviously, medics and nurses, but I'm not sure whether we see as many pharmacists or AHPs. And given that one of the requirements to become a CCIO is that you have to be a senior clinical leader, then do we not have a challenge in making sure that we almost need to build more of a pipeline of people in non-nursing and non-medical professions to even get to the point of being a senior clinical leader, if there's any hope of them ever becoming a CCIO? So I don't know whether anyone has any thoughts on that. Gareth?
Yeah, so I think, Yinka, I mean, you said that these need to be senior clinical leaders. I don't think that's necessarily the case. And I think one of the challenges is how we diffuse this out across the team. So exactly as on any unit, you would have an educational leader or an audit lead, we should have somebody who's got, you know, a bought-in interest into the power of informatics. So yes, ultimately these people could become senior clinical leaders and become a CCIO. But for me, it's how do we get that more diffuse and sort of embedded across all of our teams as you could call it a clinical lead or clinical informatician. So I think that's a route whereby we can make this more attractive to a wider range of professions.
Okay, thanks. Joan?
I was just going to agree with Gareth and also say that I think you're right. I think the pipeline is the key part of this, is how do we develop people from their early interest in clinical informatics through to then both developing their clinical informatics competencies and expertise, but also developing as leaders and up to executive level alongside that. And that is the work that we need to do at this point, is to do more around how we do that. Coming back to what you said though, Yinka, around the allied health professions, it is now the case that you know, that most organisations will have a chief pharmacist or a chief allied health professional. So there are examples of how that works, and it's similar, as I was saying, about nursing, where nursing informatics in the same way is not quite recognised yet. But I think the really key thing in all of this is the more of us who are from across the breadth of all of the professions who want to get involved in this, I think that's the key part of it. The more we see it, the more normal it will become for it to be a collection of professions.
Yeah, thanks. Okay, so I'd like Steve.
Just a note on the different settings, just to clarify.
Mm-hmm.
So in Scotland, the health board covers hospitals and community care. The health board holds contracts with the contractors in the community, like GPs, pharmacists, optometrists, dentists. So a CCIO role in a Scottish health board would inevitably cover those areas as well, community and hospital, although the office would clearly include people who are more specialised in those settings as well.
Thanks. I would like to move us, I'm going to come back to you, Gareth, if that's okay. I'd like to move us to a question which is about how we actually implement this. So there's a question from the audience, which is, what is the panel's advice about how to now practically implement from a CPD and annual appraisal point of view? And any advice on how we manage this with our HR colleagues, and effort needed to review and align current CCIO JDs that people are currently working to. So how do we practically implement is the main question. Afsal. Oh, sorry, Caroline, were you first?
Yes, I am.
Caroline, I'm sorry, let me come to you, Caroline.
Not that I'm going to give you the answer anyway, but I know that Joe will have the answer for this, because I know that NHSX and NHS Digital had conversations on how we're going to progress on developing the competencies of nurses in terms of digital. But I think there are works around developing CNIOs and competencies, Joe? Nationally.
I'm sure that's why Gareth's got his hand up. So I'm going to defer to Gareth on this one. If it's not why he's got his hand up, then of course I'm happy to answer that question. But
okay, Asa, would you mind if we quickly skip to Gareth if he's poised to answer that particular point?
I wasn't going to say that actually, but
oh, okay,
I was going to make another point. Do you want me to make can I make a another point actually? So what I was going to say is a little bit around CPD and appraisal. Actually, sorry, I lost my chain of thought there. So I think that for everybody who's got these hybrid roles, it's really important that we separate out the professional line management from the sort of the operational line management. So it's something I've always tried to do since I've been in any form of leadership role, is have two appraisals and be really clear that these are separate. What I think we have to accept that at the present time, it is messy. So it will not be perfect in terms of what are the competencies required of a clinical manager or of a CCIO. But I think we all need to make the effort and the commitment to having those dual appraisals and keeping that appropriate professional log in terms of how we balance those things. What I would say is if you consider the potential harm that can be done in a clinical informatician role, it's significant as compared to how a clinician can do harm. So we really need to be clear that this is measured in an appraisal, and we have appropriate development plans behind that.
Thank you.
And Joe, if you want to type your question in the chat, I'll answer it.
I'm going to come to I'm going to come to Afzal, who's been waiting patiently.
So thank you. What I was going to say, one of the other roles that I do is I contribute to the steering group for the Digital Academy, and I know that they and many others, including the faculty itself, there's been a real significant increase in the types of professional development type activities that are available to people. And whilst the academy itself has been focused on the sort of most senior leaders in the last few years, there's also a lot of work that's going on behind the scenes and will be coming out shortly around helping people at all levels of their career, of whatever professional type, to start to develop the skills that they need to progress the competencies that are listed in this role. So I think it's and as Gareth says, it will be a little bit messy for a while. And I sort of liken it to how medical education used to be back in the day, where medical education was a sort of bolt-on thing that a few enthusiasts did. And now there are, proper formulated medical education pathways. And I see informatics heading in that sort of direction. And whatever is true, from that medical perspective, I don't see any reason why that sort of opportunity couldn't be taken in the fields of nursing, pharmacy, and all of these other disciplines.
Thanks, Afzal. Joe, did you want to answer the question?
Yeah, I was going to answer Caroline's question or further with Caroline's point. So yeah, we are working centrally on some work, particularly from a nursing perspective, around competencies and the development pipeline, as we talked about it earlier, so that nurses can be supported through the journey that they have in informatics, and we are working on that at the moment. I believe there may be some others of the professions that are doing something similar as well. But also just wanted to support what Gareth said, because I think it's really key that actually this is about maintaining clinical credibility alongside being a clinical informatician, and we need to be really we need to really support people to be able to do both tracks. And from a nursing perspective, that can be more difficult in my experience, because nurses obviously tend to come into the digital roles more on a full-time basis, but we do need to find ways of making sure that they can be supported to maintain clinical credibility, if not actual clinical practice on a regular basis. So I do think there's a little bit of a nuance there that's slightly different from a professional perspective.
Thanks, Joe. Vijay, you're on mute, Vijay.
From an academic perspective, there's also the potential now that competencies are defined, start pushing some of these upstream. So as part of what I do in terms of teaching at Brunel Medical School, is trying to incorporate the clinical informatics as being part of medical practice, as opposed to something that someone comes to later in their career. Bringing this all together just means that we are building for the next generation of clinicians who are literate in informatics.
Thanks. So we've got under 10 minutes left. We've got lots of questions still in the Q&A. I would like to, there's a couple of questions which relate to career pathways, actually, which I thought would be interesting to explore. So there's a general question about what is the career pathway for a CCIO, but there's also a question about what does the panel think about appointing clinical scientists into CCIO roles as well? So broadly, is there a well-trodden path to become a CCIO, or I guess from your experiences, has it been quite non-standardized? You know, what's your view on that, Steve?
Well, from a clinical scientist perspective, our ones locally frequently remind me that they had an IT department before an IT department existed in the overall health board. So you know, labs have been dealing with data and its benefits and risk of harm for a long time. So I see no problem at all with a clinical scientist being a CCIO. In terms of a career pathway, I think there is definitely not a straight line route, and I can't imagine there would be any time soon. I mean, I often say to the medical students, you know, get involved. You're interested in this area, help out in projects. Junior doctors doing management projects. It could be a healthcare informatics management style project that they do. Loads of opportunities to get involved for those who are interested. And then there are various sort of project support officer roles for, you know, for order comms, for prescribing, for various optimization efforts that are going on. That all gives people a chance to build their CV, maybe get on formal courses. And there is the question about whether you need formal academic qualifications for this role, but I think increasingly the answer to that is probably yes. So yeah, take opportunities, say yes to them.
Yeah, that is always good advice, actually. Just say yes. Gareth?
Yeah, I absolutely support what Steve says. So, you know, my experience to date that there isn't a standardized pathway to these careers. We do need to put structure around it, which is why the role of the job description and competency frameworks, appraisal, etc., are essential. But then alongside that, we also need to encourage innovation, and the types of people we need to step into these roles are the people who think differently and will function differently in a team. So there's that balance between trying to standardize and keep practice well defined and regulated, whilst at the same time keeping it open to innovation and different ideas. If I look at the people who are coming through, for example, through NHSX on the FMLM leadership scheme, these are people who have got really broad portfolio careers at a very young stage or very young age in their development, which is fantastic to see, and we need to harness those people. I am just going to go back to Caroline's point, which I didn't answer before, to say there is a specific challenge, I think, in non-medical roles in terms of how do we develop hybrid leadership roles for non-medical people. It's a source of real regret to me that I see people who have to make a jump, if you like, into one role or the other, which isn't the same for doctors. And I think there's more to do with nursing and AHP in terms of how we have that hybrid role as part of that messy career development.
Thank you, Gareth. So I'd just like to acknowledge some of the comments in the chat. There have been quite a few comments regarding the pipeline issue, actually, and how we need to do a lot more work in terms of growing the pipeline of non-medical, well, just a more diverse pipeline of individuals. We have got some comments relating to some of the curricula and the CPD and training support that's needed. I think probably it's worth me just saying, so I've recently just taken on this post at NHSX, and one of the, there's a core aspect of the work is around sort of mapping out in a collaborative fashion, so working with colleagues across the system, career pathways for the professions, the digital and informatics professions, as well as working to map out all of the courses and curricula that's available to help with the CPD, so that people in these roles know how they're meant to achieve various CPD points, and the resources are much more transparently available in a much more transparent way. So watch this space, but I guess I want you to go away feeling a little bit more reassured that this is very much high on the agenda at a national level as well, and we'll be working with all of our leaders across the system to try and make this a much better place, really, and to make sure that it's a lot clearer if you are wanting to work in any of these roles. So I think, as we're coming to the end of the session, I think I'd just like to ask the panelists to reflect very briefly on if you could choose one thing, what would be some of the other environmental issues that you feel we would still need to address to make the pathway and the experience of the CCIO better? Just one thing, if you can think of one thing. So shall I start with Steve and then give everyone else time to think about it? Steve.
Well, I think the main thing, as someone said in the comments, is the chief execs. Unless we've got chief exec buy-in, then it's hard to imagine that a lot of progress we've made in this area. So, and I know it's in the comms plan for this, so that's a key area, and it's in some cases it's developing the chief execs to be leaders for the digital age as well.
Yeah, VJ. Are you on mute, VJ?
Okay, third time lucky. So yeah, exactly the same. It's about recognizing it's a senior post, it's an executive level post. So it's about having the buy-in of your fellow execs, CEO definitely, but equally your colleagues that you'll work with, the CIO, maybe the CDO and others. And also your HR department, because that will be a big thing, recognizing if you're looking to build an entire department, there's going to be questions raised about what's the return of investment, what is the evidence base for what you're trying to do. And it's quite hard to have the reverse conversation about this is about improving patient safety and sort of addressing the sort of the quality loss function in terms of reducing the waste that happens because we haven't done this correctly in the first place.
Yeah, I agree. Gareth?
I'm going to slightly answer your question in terms of the effectiveness of the role in the team. And I think one of the things we talked a lot about here is diversity in terms of the clinical background. But what we've not talked about is diversity in terms of who is within that team and how do we ensure inclusion and equality of opportunity. And I know that the Shuri Network are doing a lot here. And for me, that is something else that should be completely flagged within this, the professionalization agenda, is how do we ensure that our teams reflect the communities which we serve. So it's slightly peripheral to your question, Yinka, but I think it's about that's how we'd make the whole function of the CCIO office much more effective.
Yeah, thank you. Jo, do you have any reflections?
I would agree with what other people have said. I think the wider exec team is the key link. The other thing, if I to say something different, would be the involvement of higher education institutions throughout the whole of the pathway into these kinds of roles. So I think that's another environmental factor. In the same way that you want to get the exec colleagues engaged in the digital agenda, there's that need for that right from undergraduate education right through to postgraduate and specialist education, and it needs to be understood there as well as within exec boards.
Thanks. Caroline?
Yes, it's more or less similar, and I echo most of everyone else's message. So it's about having the corporate, the clinical operational, and the digital team within the board or the organization to be working together, using diverse knowledge and skills to enable the digital and operational needs of the organization or whatever boards are working together.
And last but not least, Afzal.
I genuinely, I haven't got anything to add to all that's been said. We're all in unanimous agreement, I think.
Mm-hmm. Okay, well, it leaves me to can bring this panel discussion to a close. And and to thank all the panelists. I think it's been a really insightful discussion, and really hope that the audience has also found the discussion really interesting as well, and has got some things to take away with them. This is the start of the conversation though. So as I mentioned, the formal consultation period for the job description kicked off in September, and I believe it is concluding in November. I think I might need Lindsay to confirm whether it's when exactly in November, but it's November. So on our website, and actually if you could post a link in the chat, that would be helpful. It's the end of November. There is a link that will take you through to how you can participate, and we would greatly encourage you to participate. This is a great opportunity for you to have your voice and to influence the outcome of this. So thanks again, and look forward to meeting you again in the future to discuss this further. Thanks very much. Enjoy the rest of your afternoon.